All right, shifting gears. So we talked a lot about body. Going to shift a little bit to mind and your mental health as you age. Especially during, we've had a couple challenging years here with being in a pandemic, a lot of us experiencing isolation, a lot more stress and anxiety maybe than even
Right.
we have been used to before. Do notice if you're uncharacteristically irritable, anxious, or sad. Recognize that challenges with anxiety and depression are normal potential challenges with getting older. And
Hmm.
that's could be due to factors that are just in your um, as part of how you age. Maybe you've lost somebody. Maybe you have been having to provide care for a loved one, and that's become really challenging. And your brain does change as you age too, and sometimes you become it's easier to become really anxious. Maybe you're noticing that you get anxious a lot quicker than you used to when you were younger. Those things are normal to be occurring when you're getting older.
And you know what? I think that is so important. What you just said is that I think as we're all aging, that we need to accept that and not get all hung up on, that we shouldn't feel that way. We really need to understand that we are getting older and things are happening, and just, try to accept it and be positive and, whatever. So,
Yeah. Often when I talk to my patients about this, I say, usually what I hear people say is they want to continue to function and they want to continue to be the best version of themselves, right? And
yeah.
so sometimes you're having trouble doing that. And that's just because you're aging and we can talk and work on that.
Yeah, I have to tell you, my dad lived to be 105 years old, and he was very healthy right up to the end. And the whole lesson he taught me was he was so positive about life. He was just really, so, his mental attitude was so great, so positive. But, he was healthy too, so that makes a difference.
Yeah. And identify those in your life who you can talk to, who you trust,
Yeah.
and talk to a doctor or a therapist. It doesn't just
Mhm.
have to be a doctor; it could be a therapist. Uh, and use resources to help you continue to be that best version of you.
Mhm. That one is so important, so important.
Things to avoid: thinking you can do it alone or fix yourself. Um, a lot of times, or shaming yourself for having challenges in this area. And
Yeah, that's a big one. That's a big one, shaming yourself. We all do that. I mean, it's ugh. Well, I don't mean we all do it, but a lot of people do it. It's like that's a big one, Dr. Downing, is shaming yourself. That's
and
so
there's
easy to do.
Yeah, and these are common symptoms of mental health issues or depression, especially is
Yeah,
the self-shaming or thinking you won't or can't get better.
right. Those are good ones. I like those.